Hi everyone, Dr. Kristina here. Welcome back to my channel. Now today what we're going to be doing is talking about forward head posture and the TMJ area. So stay tuned, I have a lot of information I want to share with you. Now don't forget to subscribe and hit that bell icon so you can be notified every time I post a video. So in today's video, we're going to go through a few things. So I want to talk about the TMJ, or the temporomandibular joint itself. I'm also going to cover a little bit about how do you know if you have a TMJ problem, and more importantly, how your posture can affect your jaw. So your temporomandibular joint, or TMJ, is a joint that is very well used in the body, because it's used when you chew or talk, or even breathe if you're breathing heavily through your mouth. And so it can take a pretty heavy beating. Now, one common misconception is that when you say, oh, I have TMJ, kind of it's become known that, okay, you have an issue with your temporomandibular joint. But what TMJ means is just temporomandibular joint. So when you say, oh, I have TMJ, it's kind of like saying, yeah, I have the temporomandibular joint. So it's actually not really saying anything, except it is an accepted abbreviation for when you have trouble with your jaw. But the actual terminology you should use is temporomandibular joint dysfunction, which is TMD. So that's the actual way to describe what you're going through. However, most chiropractors, physiotherapists, massage therapists, what have you, even doctors as well, they all understand that when you say, I have a TMJ problem, or I have TMJ, they understand what that means. But the proper term is temporomandibular joint dysfunction, or TMD. So moving forward in this video, I'm gonna refer to it as TMD. How do you know if you have a TMD problem? So common symptoms for TMD include pain, right, in the face, pain in the jaw, along the jawline, pain around the ear. It can be pain in the face or the neck or the upper back even. So you don't necessarily feel it, you might not always feel it right here, but it can actually ricochet and have an effect on all these supporting structures. Some symptoms you'll also be able to include for TMD are clicking and popping in the joint. So if you open your jaw wide and you get popping or clicking, some people even unfortunately have locking. So that joint will lock on you and you won't be able to close your jaw, which is also a really more advanced TMD issue. But all of these are considered symptoms of TMD. Also can be included ringing in the ears and just difficulty opening your jaw. And this all has to do with how the joint is sitting within the socket and how the musculature have adapted to that. Sometimes they become, because the joint is out of place, or sometimes you might have a congenital issue with your jaw that when it was malformed, right, as you grew, and so the musculature is going to respond to that and it'll get really tight. So you can also have a lot of jaw issues, not only in this part, but up into this part of your head as well. So there are a lot of different components going on with TMD. Now I'm just going to discuss how your posture, and more specifically forward head posture, can affect your jaw. Forward head posture actually places the condyles of the jaw deeper into the socket. So you have a condyle, which is an articular surface, which is a fancy word for saying joint, okay? So the joint, the head of the joint that goes into the socket, into your jaw, with forward head posture actually goes deeper into that socket. And this specifically might be the source of the pain. And of course, guess what? That lovely slouching posture that we do on a regular basis that we don't always notice or catch ourselves doing. So you're slouching on the couch, you're slouching, working over your computer, you're doing that forward head posture position, which we talked about in previous videos. This is not only bad for your back, your low back, and your neck, but it also has an impact on your jaw. Having a slouched sitting position from the pelvis up results in forward head posture as a way for the body to counterbalance itself. So if you are slouching, if you're slouching forward, you actually have to tilt your pelvis backwards. And when you tilt your pelvis backwards, your weight goes further back like this. So in order to compensate, your body has to move in a head forward posture to counterbalance your weight. This is very specific for when you are standing and you're slouched over something, but it's even true for when you're sitting, because just that biomechanical shift that you're doing redistributes your weight in a different way, and your body has to compensate for that because it wants to keep your body over your center of gravity, and so it's going to manipulate your posture. This posture also creates a length tension alteration in the relationship of the muscles attached to the jaw, and can trigger hypertonicity, which is an increased contraction or increased tone of the muscles, and these muscles will compress the jaw. Imbalanced muscle forces around the jaw, including the suprahyoid muscles, which are under the chin, and they are helpful to open the jaw, are usually weaker when compared to the masseter, which is a muscle in here, and the temporalis, which is above, actually at the side of your head. And these muscles are used to compress the jaw. So these muscles will be tighter, so they will be contracting and hypertonic, and so you'll be getting the pain and the issue inside the joint. So what I like to see, what I check when I'm assessing the jaw, I'm always assessing posture. I'm checking for head forward posture. I'm checking for tight musculature around the jaw, and I also check for movement patterns in the jaw. So I'll be asking you, or I would ask a patient to open and close their mouth so that I can properly see how the jaw is moving. And if it is an abnormal movement of the jaw, then that will affect treatment. A way for you to check at home if you have a TMD issue, a temporomandibular joint dysfunction, is kind of simple, really. So you need to stand in a mirror, and you're going to put your tongue on the roof of your mouth right behind your front teeth. So like this. Like that, you're going to keep it there and open your mouth as wide as you can. Don't strain it, okay? You'll probably be able to notice a shift anyway pretty soon, as soon as you start to open your mouth. But check the lineup of your teeth. When you have an issue opening your mouth like this with your tongue right behind your teeth on the roof of your mouth, you will notice a slight deviation. So it'll open and it might curve to one side, or it might do this. It might do a bit of an S curve. If you see that happening, then you can kind of deduce that there might be something going on. So if you notice this, or even if you've just had clicking or popping or crunching in your jaw, and you really are annoyed with it and it's something that's also causing you pain, please get it checked out, and they'll be able to give you some great treatments for dealing with temporomandibular joint dysfunction. There you have it. That is today's video on head forward posture and your TMJ. So thank you so much for watching. I really hope you enjoyed this video. If you do enjoy videos like this, please give me a thumbs up so I know you like them and I can make more like this. Also, don't forget to share. That would be awesome if you could share with friends and family, anybody you feel could benefit. And again, don't forget to comment. Let me know what are the things you do for your TMJ, and I would love to hear from you. Don't forget to click that subscribe button, and thanks again for watching. I'll see you next time. Bye.